A normal human pregnancy lasts for 40 weeks, which is a bit more than 9 months. However, if the birth occurs before that term of 40 weeks, it is called a preterm birth. According to World Health Organization (WHO), preterm births occur in or before 37 weeks. WHO further categorizes preterm births into 3 categories: moderate to late preterm birth when it occurs between 32 to 37 weeks, very preterm birth when it occurs between 28 to 32 weeks, and extremely preterm birth when it occurs in less than 28 weeks. Why is it a problem? Preterm birth is a big problem. It is the leading cause of infant deaths in developed countries like the US and Canada. It accounts for 75% of infant deaths in the US and is the second leading cause of infant deaths in Canada. It is also a leading cause of long-term neurological disabilities in children. These disabilities can translate into breathing problems, feeding difficulties, cerebral palsy, developmental delay, vision problems, hearing impairments, and many more as the infant grows. Research has shown that preterm birth rates have risen in most industrialized countries. In the US alone, it has risen from 9.5% to 12.7%. What are the causes of a preterm birth? Preterm birth is now thought to be a syndrome, which is a combination of correlated symptoms. Spontaneous labor at term occurs when the fetus has achieved maturity and is ready to face extrauterine life. It signals the onset of labor and engages the cooperation of the mother in this process. On the contrary, premature or preterm labor results from a diseased environment in the uterine that activates the common pathway process of childbirth. Dr. Roberto Romero, a senior investigator at National Institute of Child Health and Human Development (NICHD), have mentioned 7 specific pathological contributors to preterm birth in one of his studies. The 7 contributors are inflammation or infection inside the uterus, low levels of blood supply to the uterus, an exaggerated enlargement of the uterus, an abnormal reaction to a transplant, allergy, cervical insufficiency or an early widening of the cervix, and hormonal disorders. Other factors like mother experiencing stress or starvation also contribute towards preterm birth, but they are external in nature, so they are not accounted as pathological contributors. Is there a way to prevent it? Prolonging the gestation period artificially is not a viable option because mostly the compromised intrauterine environment is the cause for the preterm birth. Thus, it is better to have a preterm birth for optimal fetal, infant, and lifelong health of the newborn. There are no direct preventative measures. However, interventions can be taken to reduce the risk of infant death. These interventions can be classified into 3 categories: primary, secondary, and tertiary. Primary interventions are directed to all women before or during pregnancy to prevent and reduce risk for preterm births. It includes educational programs, prenatal nutritional supplements, prenatal care that involves regular checkups and promotion of healthy lifestyle. Secondary interventions aim to eliminate or reduce risk in women with known risk factors based on their obstetric history. It includes nutritional supplements like omega-3 fatty acids, which is associated with reduced production of inflammation-causing agents in women. Progesterone supplementation also has similar effects on women. Tertiary interventions are initiated after the childbirth process has begun, with the goal of preventing delivery or improving outcomes for preterm infants. It includes antibiotic treatments to reduce risk of neonatal infection, and administration of corticosteroids to women, which helps in proper development of lungs of the preemie. So now we know answers to 4 basic questions concerning preterm births. What is a preterm birth? Why is it a problem? What causes preterm birth? Is there a way to prevent it? Research shows that even though the rate of preterm birth is not declining, the survival rate of preemies has increased due to the primary, secondary, and tertiary interventions made. NICHD has developed an algorithm that could be used to predict the outcome of a preterm newborn infant, depending on the gestation period, weight of the baby, number of babies delivered, and administration of corticosteroids. It gives out percentages of various aspects, like survival, survival without neurological impairment, death, or neurological impairment and death. It is only good for predictions. Thanks for watching.